Scrolling through TikTok, you'll find video after video on mental health and disorders. But often the information being spread can be misleading or even harmful. Some parents and experts have expressed alarm over teens self-diagnosing themselves with ADHD. And as the drug shortage to treat it continues, some creators are offering alternatives to medication. In today's Health Talk, we're breaking down that information with Dr. Justin Schreiber from UPMC Children's Hospital of Pittsburgh. Such an important conversation, too, because I can't tell you how often I'm seeing these videos pop up on social media. So let's talk first about ADHD, what it is.
Yeah, so ADHD is a neurodevelopmental disorder, which is diagnosed at youth. So we know that kids will present with it and then can sometimes continue into adulthood, but really should affect things for executive functions such as attention, hyperactivity, impulsivity, and make those more impairing for people.
And so what I've been seeing a lot on social media too is that even adults are saying, oh my gosh, maybe I've had ADHD all this time and I've just never been diagnosed. And we're seeing this increase in people either self-diagnosing or getting themselves diagnosed through apps or mental health apps, something like that.
Yeah, I really encourage when people have that question to say, is this possibility of, am I struggling with attention? Do I struggle with this now or in the past? Really trying to think about accessing support from, from your pediatrician or primary care provider, who oftentimes are very well trained in development and understanding what are the signs. So is this someone who we know for ADHD that this is something should really present in early ages? So did you struggle with inattention, hyperactivity, impulsivity at those young ages? Or was this something that maybe has come as we've got more expectations, and so maybe more of just having to learn certain skills? And
so symptoms that parents should look out for in their kids? I mean, because kids do have a lot of energy and sometimes don't pay attention the way we would like them to. So how do you know when there's an issue? Definitely,
yeah. You can see for a lot of kids, and having a 7-year-old myself, that they run around quite a bit. They have a lot of energy, which is great. And at the same time, we think about impairment for it. So in multiple settings. So something where in school you're hearing about difficulty with sitting still, they're moving around all the time, they can't keep their focus there. We're hearing that maybe that they're jumping into a conversation, and so that's causing problems with their friends. Or kids who are just running across the street because you can't, even after you remind them over and over again that they can't look both ways, are really important signs. And also just focusing, making sure that are they struggling, even though we know they're intelligent, they can do well, but they just can't seem to keep it together.
What about in kids too, especially? Is there a difference that you'll see in presenting symptoms between girls and boys?
So, I think it's a really important point, because a lot of times we see that younger girls are often missed because there might not be the same hyperactivity, impulsivity, might be more struggling with that focus, and someone thinks, well, they're not disruptive, they're not making a problem in the class, they're not talking back or running around, and at the same time they're really struggling with that focus. And so, as a parent, really being able to identify this person is really struggling with that.
So what about the self-diagnosis that's happening on social media and other platforms?
I would highly encourage, when someone is concerned, when a family member is concerned, again, talking to your primary care provider, getting that evaluation done so that they can look at all settings, school, home, and really getting a real thorough evaluation before moving forward with any treatment.
Can we talk about the treatment options? Because Adderall is one of those ones that's become kind of that common name that you hear when you hear ADHD.
Yeah, so there are two main groups, Adderall being one group that has multiple different types of formulations, and then Ritalin being the other with other formulations. There are a couple other different types of medications that people can talk with you about as well. Those are the main ones that have very good evidence. They're very safe, and so we encourage, with talking to, again, your provider, to be able to find out what's the best fit for you. But also thinking about things like being out and being active, we know can be really helpful. Getting good support around organization, things like that can also be beneficial as well.
So another video that I saw was someone suggesting that saffron could have some benefits. Can you talk to us about that? Is there any truth to that?
So what I always say is we want to go with what has a good evidence base. There is still more that we have to learn about what medicines can do, but we want to make sure it's safe and it's something that is going to be effective. And so there have been studies that have looked at various different alternatives, and at the moment, nothing has really been nearly as effective or been as safe. And so if you ever see something, I highly encourage talk to your provider about that, just to make sure.
Yeah, I mean, just because you see it online and it's working for someone or seems to be working for someone does not mean that you should just instantaneously try something yourself.
Definitely, yeah.
And so are you seeing any issues that pop up with schools being able to handle this? I mean, is there an influx in people being diagnosed with it at a young age?
Yeah, I'm glad you bring up that, because I really think that when we look at it, there's a lot of actually reduction of stigma that's led to more of us being able to understand and recognize symptoms, people asking about it. And so what we've seen is an improvement in being able to diagnose. And so that's why we've seen this increase. And that's also meant helping and supporting kids more. So helping schools understand how to support kids who are struggling with focus, with hyperactivity.
Thank you so much for coming on and talking about this. I know these videos are floating out there, and ask the important questions.
Definitely. Thanks a lot for having me on.
Thank you. Well, if you're interested in the behavioral health services at UPMC Children's Hospital, you can head to our website, kdka.com/talkpittsburgh.